Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is about multiple sclerosis, MS. Definition, physiopathology, clinical presentation, diagnosis, etiology, and treatment. Multiple sclerosis, MS, or disseminated encephalomyelitis is a demyelinization of nerve cell. Influx transmission is disrupted. The fourth parallel north is a circle of latitude that is 40 degrees north of the Earth's equatorial plane. It crosses Europe, the Mediterranean Sea, Asia, the Pacific Ocean, and North America, and the Atlantic Ocean. Above and below latitude 40 is the predominance of multiple sclerosis. Why? Because there is the cold is favorizing and the less exposition to vitamin D. Physiopathology, it's an autoimmune disease. That means there is autoantibody against myelin. The mechanism is a disruption of the immune system, deficiency in myelin production cell. There is some genetic factor, and there is environmental factor like viral infection. Antibody against myelin. Here's a normal nerve, and here's an affected nerve, and damage to myelin. Symptoms include double vision, blindness in one eye, muscle weakness, and sensation or coordination disturbance. Unable to completely close the eye with eyebrow drops. Optic neuritis and diplopia. Regarding the smell, there is a diminished sense of smell. Muscle swallowing difficulties and muscle spasm, especially foot drop. Regarding touch, there is a numbness, a tingling, and burning sensation with itching. What about sex? There is an erectile dysfunction and there is a decrease in desire. Patient can undergo balance change with vertigo and dizziness. Most of the time, patients show an urinary incontinence. Often urinary incontinence is associated with erectile dysfunction. There is a trigeminal neuropathy. What about feeling? There is a depression, personality change, and sometimes inappropriate laughing or crying. Difficulty walking by limb weakness and paresthesia, and by muscle spasticity. The disease can present in three situations. The relapsing-remitting, RR, which is the alternating between the better and the worse. The primary-progressive, PP, which is worse from the onset. The secondary progressive is P. It takes some time to progress. It could be isolated attack. Progressive form the scene accumulate over time. Between attack, symptoms may go away completely. As the disease progresses, neurological disorder become permanent. What about diagnosis? MRI is the best initial test. MRI is the most accurate test, in 19 to 99% specific. But if MRI is not conclusive, we do CSF electrophoresis, looking for oligoclonal bands. There is no cure to date. The treatment presents further attack. It is modestly effective. It has side effects and can be poorly tolerated. Physiotherapy improves quality of life. Alternative treatments have not been proven. Treatments include acute steroid, and to prevent exacerbation, immunomodulator. Modifying therapy include interferon, sequential maintenance treatment, including glatiramer and mitoxantrone, used to treat. This drug is used also to treat prostate cancer. Let's review. Symptoms include limb weakness, paresthesia, spasticity, trigeminal neuropathy, vertigo, optic neuritis and diplopia, urinary incontinence and erectile dysfunction. Now, in that, mental status is intact. Clinical presentation, there is 3 clinical presentations. Relapsing remission, alternative between better and worse. Primary progressive, which is PP, worse from the onset. And secondary progressive, SP, it takes some time to progress. Diagnosis, MRI best initial test, MRI most accurate test, in 19 to 95 specific. If MRI is not conclusive, CSF electrophoresis, looking for oligoclonal bands. Physiotherapy, autoimmune disease, auto-anticorps against myelin. Etiology, prédominance femelle, génétique HLA-DR1, environment above and below altitude 40, because cold and low vitamin D. Viral infection like Epstein-Barr, herpes, or measles. Smoking also it is a risk factor. Treatment include steroid, if accurate, to prevent exacerbation, immunomodulator, modifying therapy like interferon, glatiramer, and mitoxantrone. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.